Good evening, everyone. Welcome to Dr. Sumner's Summit to Wellness. We are here tonight to start with our second part of our two-part series on diabetes. I'm so excited to be here tonight, and I love to have you all join in. Definitely tag your friends, your loved ones, those who you think would benefit from this very vital information. I'm really excited to be here tonight. Thanks so much for joining. Just wanted to check in. Hope you're all doing well. I'm excited. Tomorrow's Friday. We're going to get things started. I'm pumped. So definitely tag your friends. Share this. I think is going to be very vital and helpful information for you all. We're going to continue with our part 2 series of diabetes. So for those of you who don't know me, I am Dr. Felicia Sumner. I am your board certified family medicine physician. I am dedicated to helping you and your loved ones get well. To me, well means whole, energized, and loving life. So that is what I want for you and for your communities. So thanks for joining me tonight. We're going to be talking again about diabetes and specifically what we can do to reverse diabetes. So let's get started. For those of you who know anybody who could benefit from this information, tag, share with them. Let me know if you're watching. Just comment below. Give me a like. I'd love to see who's joining us. And if you're catching the replay, then just hit hashtag or type in hashtag replay so I know who's joining. Thanks so much for watching, Tisha. Thanks so much for watching, Selena. Happy to have you guys here. All right, so let's get started. Tag your friends and we'll get started. So we're going to be talking about diabetes. Just to recap, our last Summit to Wellness episode, we talked about diabetes, more so what is diabetes, what causes diabetes, especially this idea of insulin resistance, and what other labs do you need drawn if you're diagnosed with prediabetes or diabetes. What should you be asking your doctor? So tonight we're going to follow up with that and talk a little more deeper into insulin resistance. We're going to talk about why does that lead to diabetes, and are there medications that we take and prescribe for diabetes? Are they actually helping us, or could they even be hurting us? How might they be hurting us? And if you're on insulin or some other medication, how can you change things in your lifestyle to possibly get off of these medications and reverse diabetes? Yes, I said it. You can reverse diabetes. So let's get started with our talk. Just a reminder, diabetes is no joke, guys. It affects so many people. 1 in 4 Americans, yes, you heard me, 1 in 4 Americans over 60 years old have type 2 diabetes. That's a lot of people. And so this is a real issue. And that means that over 100 million Americans have diabetes right now. 100 million. And by 2020, the year 2020, 1 in 2 Americans will have prediabetes or diabetes. So that's nuts. I mean, it's affecting so many people, and we've created so many medications. We've done so much research about this, and there has been some improvement, but not to the extent that we would think after, 50 plus years of research and medications to cure or treat this disease. There's still so many Americans affected. So why is that? We're going to chat about that and what we can do to change things so that we can kill these statistics, guys. So how about this? Let's first talk about the risk for diabetes or prediabetes. What do you think are some of the risks? What is in our lifestyle, in our genetics, in our environment? What things do you think puts you at a higher risk of developing diabetes or prediabetes? Please type it in the comment section. I'd love to hear what you guys think puts you at risk for diabetes or prediabetes. But let's keep in mind, prediabetes and diabetes, it's basically on a continuum where it dramatically increases your risk of heart disease, stroke, cancer, infertility, sexual dysfunction, depression, dementia, and the list goes on and on. And I'm not talking about just diabetes can increase your risk of these diseases. Even pre-diabetes can increase your risk of these problems. So you can have pre-diabetes or insulin resistance, which is a precursor to pre-diabetes, and that affects 80%. 80% of Americans, guys, are insulin resistant. So a lot of us are at risk of developing pre-diabetes or diabetes, and that's why it's so important for your doctor to diagnose pre-diabetes as early as possible, and implement an intensive lifestyle program so that you can help reverse this condition. So what do you guys think? Let's see what's in the comments as to what do you think are the risks for prediabetes or diabetes. I'll give you a few, and it's my pleasure, Dia, for sharing this information. Thanks so much for joining, and definitely tag your friends and loved ones who you think would benefit. So some of the risks of prediabetes or diabetes are if you have extra belly fat, so your abdomen is round, that puts you at risk. If you have a family history of diabetes, if you have gestational diabetes, which is diabetes in pregnancy, if you're in an ethnic group that's at risk, which includes Native Americans, Hispanic Americans, African Americans, Asians, Middle Eastern, so that's a lot of groups of ethnic groups who are at risk of diabetes, or if you have high triglycerides, which are the amounts of fats in your blood. Hi, Shanae, thanks for watching. Or a low HDL, which is a type of good cholesterol. If that's low, you're at risk of prediabetes or diabetes. Eating a lot of carbs, yes, Latoya, you're correct. That definitely puts you at risk, and we're going to talk about that a lot more shortly. Or even if you have high blood pressure. So all of these things put you at risk of developing prediabetes or diabetes. So if any of these things apply to you or those you love, or you have some other cause for concern, then tonight we are going to talk about what do you do to prevent this condition, and if you have it, what do you do to reverse it? So we talked a lot about last week about diabetes, and that it's a part of this constellation of syndrome of conditions that we call metabolic syndrome, which is due to insulin resistance, and that's a key term that I want you guys to really understand. So if you have this condition, you know what you're fighting against. So let's review insulin resistance really quick. Type that in, insulin resistance. So insulin resistance, it isn't just a disease. It's more of a state in which insulin and glucose, your sugar, are no longer maintaining a working relationship. Insulin and sugar, they're not really communicating in the way that they need to. So how does this happen? Well, it actually comes down to sugar and carb intake. So when you eat a lot of sugar or too many carbs for your unique body to handle, your body in a sense becomes desensitized to it, basically. So think of Charlie Brown and the teacher that he always used to drown out. That's basically what your body is doing to insulin when you develop insulin resistance. That's more or less what's happening. So this cycle, it creates insulin resistance, and it goes something like this. So I came up with a little image here that I think will help you guys understand a little bit what this cycle of insulin resistance is. So let's go over it. Basically, you eat too much sugar, or carbs, that as well, and that leads to chronically elevated levels of insulin. And let's be reminded again, what is insulin? Insulin helps to bring your sugar out of your blood into your cells so that your sugar levels aren't too high. Okay? So you eat a lot of sugar, that leads to high levels of insulin, and then sugar or carbs, high levels of insulin, that leads to, guess what? Elevated levels of serotonin. What? Did you know that? If you end up releasing insulin, guess what? Serotonin, which is that feel-good hormone, that also is released from your pancreas, what we call the beta cells in your pancreas, the same exact cells that release insulin also release serotonin, the feel-good hormone. In addition to that, when you are releasing insulin, you also end up with elevated levels, higher levels of dopamine. What? Dopamine is that pleasure hormone. It creates a temporary sensation of pleasure. So you eat a lot of sugar and carbs, you get high levels of insulin, and then that increases your serotonin levels and your dopamine levels, your feel-good hormone, your pleasure hormone. And guess what? Of course, because you feel so great, you're going to end up you're going to develop more cravings for more sugar and more carbs, and that ends up leading to these wild sugar levels, highs and lows of your sugar. So basically, again, a lot of sugar, a lot of carbs, your insulin goes up to bring that sugar level down. Guess what? At the same time, your feel-good hormone, serotonin, your pleasure hormone, dopamine, those are up. You're feeling good. No wonder you develop more cravings to sugars and carbs. But it doesn't even end there. It doesn't end there. As you continually seek to fulfill those cravings and you get those peaks of temporary pleasure from these serotonin levels, these dopamine levels, the amount of sugar and carbs you need to feel good again, those demands, they increase. They keep increasing, and then your body will eventually reach this threshold for dealing with all of this madness. And that's the point when your insulin resists working as it's supposed to. And that is what we call insulin resistance. Okay? So when insulin resistance happens, your muscle and your liver cells, they basically are saying to the insulin, come on, man, we've got way too much sugar in here. We're about to burst. So find another place to put that sugar, okay? There's too much sugar in these cells. I can't take it anymore. Your muscle's saying that. And so because of that, insulin, it can't keep up with the storage process, and then it gets lost and confused. And then your pancreas tries to solve that problem. Hey, Olivia, thanks for watching. It tries to solve that problem, and then it says, okay, I've got this. Give me a sec. Let me just make some more insulin, help a sister out. But then the insulin hormones, they fail because your body's been exposed to it too much. It's like you're not even doing anything anymore. So then you end up with both high sugar in your cells and high insulin in your blood. So then the sugar, it can't get stored in your liver or your muscle, so then it ends up getting deposited as fat. So then you develop what's called fatty liver, and most people with diabetes have fatty liver for that reason. So this whole process, it not only messes with your blood sugar and your hormone balance, but it also brings your metabolism way down, and then you end up gaining weight. That's the whole process. So it's a whole lot different than some infectious disease, right? So if you have, for example, strep throat, if you've got an ear infection, that's easy. We give you an antibiotic. We give you a medication to treat an infection. But if you're dealing with a metabolic disease, a disease that started from a lifestyle issue, when, like I said, you're eating way too much carbs or sugar, then your insulin levels go up. At the same time, these feel-good hormones, serotonin and dopamine, go up. And then you get these major, massive sugar and carb cravings because you feel so good eating the sugar and the carbs. And then it's this ongoing cycle, and you keep pumping more and more insulin, and eventually your body's like, dude, you're not doing anything anymore. Let me figure out some other way to handle this. So then you end up storing the sugar around your liver, which can't store there, so then it turns into fat, and then you get a fatty liver, and you've got tons of insulin being pumped that's not working, and tons of sugar in your cells all at the same time. So we cannot fix this lifestyle disease with a pill or an injection. We can't cure it that way, because it's a lifestyle disease. So the only way we can cure it is with a lifestyle change, and that's primarily your diet. So if type 2 diabetes and insulin resistance are the same sort of thing, it's really about too much sugar. So that's the bottom line. And if you understand that the whole problem is about too much sugar, then the solution is not to use more insulin to jam more sugar into an already full cell. The key is to get rid of it all. So here's maybe another visualization that can help you. So here's a normal situation. These yellow dots are glucose or sugar. So you've got the sugar trying to go into your cell, right? That's a normal situation right here. Then you have the insulin resistance situation. Sorry, it looks like maybe you might be seeing this backwards, but hopefully the picture still helps you out here. So this is a situation of type 1 diabetes actually, where you've got a lot of sugar outside your cell, and that's because you don't have enough insulin to bring the sugar in your cell. So in this situation, getting insulin injections, that would make sense, right? So you can bring the sugar into your cell. But here's a situation of type 2 diabetes, where you're basically in overflow. You've got tons of sugar inside your cell, and you've got tons of sugar outside your cell. And the problem is you're getting insulin, but your cells don't even read it anymore because it's just dealt with it too much, and you're no longer sensitive to the insulin. So that's the situation with insulin resistance, pre-diabetes, type 2 diabetes right here. So in type 2 diabetics who are treated with insulin forces the sugar into the cells that are already saturated, overflowing with excess sugar, and it can't take it anymore. So instead, the sugar, turns into fat through a process that I don't want to bore you with, and that's why these insulin injections result in dramatic weight gain. Yes, you heard me. Insulin can cause weight gain for sure, and it's through that process that we just explained. So the question is, hi Regina, hi Olivia, thanks so much for watching. Is there a way to treat diabetes too effectively? What do you guys think? Tell me, yes, no? Is there a way to treat diabetes type 2 effectively? And is there a way we can get off insulin and other medications? Yes, no? What do you think? Let me know. I'll tell you. The answer is yes and yes. So I've tried to simplify this process tremendously, but I really just want to get the point across that due to this complicated process, insulin is just not the silver bullet for curing type 2 diabetes. Instead, type 2 diabetes is best controlled by restoring your sensitivity to insulin. In fact, there's actually a really strong study out there that says, guess what? This is nuts. I actually found this out rather recently, but the study's been out for a couple years, that insulin treatment, if you have type 2 diabetes, it can actually provoke you to not only having type 2 diabetes that you started with, but insulin treatment can actually lead you to getting type 1 diabetes on top of the type 2 diabetes. Isn't that nuts? It's nuts. You have to have some genetic predisposition for that to happen, but it happens in a large number of people. And basically what happens with that process is that you will have, you're giving yourself genetically engineered insulin, because that's what all human insulin injections are. They're genetically engineered. And then what's happening is your body doesn't really recognize it because it's foreign to your body. You didn't make that insulin, and it can trigger an autoimmune response. Hey Teresa, thanks for watching. It can trigger a response where you start to develop antibodies to the cells, your beta cells, to the cells in your pancreas that are supposed to develop insulin. Isn't that nuts? And so basically you develop type 1 diabetes on top of type 2 diabetes because of this situation of getting insulin injections. So it's triggering this autoimmune response. And that's crazy. And with this study, it showed that the onset of that happening was around 7.5 months for a lot of people. 7.5 months, you're using synthetic insulin, genetically engineered insulin, which is any insulin that we get injected. You could develop type 1 diabetes on top of your type 2 diabetes within 7.5 months. So not only that, but there's a really strong study that came out, hi Ebony, thanks for watching, in 2016 that says that these could be the issues with taking insulin. And I just want to be real with you. Again, medications, they're great. They're great. They're great Band-Aids for disease. But when it comes to most chronic conditions, they're just a Band-Aid, guys. It's really about getting to the root cause and figuring out what do we need to change in our lifestyle to cure or reverse these conditions. But a 2016 study showed that insulin more than doubled people's risk of heart attacks, 1.5 times more strokes with insulin, double more neuropathy, 2 times more nerve damage, 1.5 times more cancer, 3.5 times more kidney damage from insulin, 2 times more deaths from insulin injection. So I'm just telling you, these medications, they may be helpful, they may be a great Band-Aid for you, but they are not benign. And I know that it's really hard to change some things with your lifestyle. It can be really difficult, but I know it's also really difficult to inject yourself nightly, sometimes 3-4 times a day, to take pills every day, to see your doctor super often. So either way, it's a difficult choice. Believe me, I get it, guys. I get it. But it's a difficult choice either way. Which hard choice do you want to deal with? Do your loved ones want to deal with? And let me address metformin real quick. That's the most common first-line standard medication. We also call it glucophage, Reamet, Fortimet. That's what a lot of people are given when they're diagnosed with diabetes or prediabetes. And basically, the way metformin works, it lessens your sugar release from your liver, it increases your sensitivity to insulin, it decreases the amount of sugar that's taken from your blood into your cells. So it's really great in a lot of ways. Hi, Michaela. Thanks for watching. You'll see your cholesterol levels will drop with metformin. You could even lose weight because it helps to bring down your appetite. So I think the metformin, personally, it can really play a positive role if you take the medication to control your sugars with prediabetes or diabetes. However, you should be aware that there are side effects with metformin as well. Because again, no medication really in most cases is benign. So the most common side effect, does anybody know some of the side effects with metformin or what we call glucophage? Type it in, let me know. A biggie is stomach distress. Yes, Latoya, that's one of the really big common side effects of metformin. And the reason that happens is, as I said, it helps you to not release or absorb a lot of sugars, but that sugar has to go somewhere, and a lot of times it will build up actually into your stomach lining and cause a lot of stomach upset. The most common is nausea, loose stools, yes, diarrhea. And most of the time the loose stools will go away within 6 weeks is typically what I inform my patients. And if you're beyond that 6 weeks and you're still dealing with diarrhea, then you might need to chat with your doctor. It's possible it's not going to be the right medication for you. Aside from that, yes, so a lot of people know about that diarrhea. It's no joke. It can worsen a pre-existing liver condition or a kidney condition, so definitely you should have your liver and kidney monitored if you're taking metformin. And a biggie that a lot of people don't realize is that it can affect your absorption or your ability to take in vitamin B12. And that's a super important vitamin. It helps with your brain function, with your nerve function, with your energy. So if you've got like nerve tingling, a lot of times we call it diabetic neuropathy. We just assume, oh, your sugar just got so bad. Now you've got pain in your nerves because of the diabetes. But it actually could be from the metformin you're taking. It sucked all the B12 out of your cells, and now you've got nerve pain. So that's definitely something worth checking out. If you have neuropathy, is what we call it, nerve pain, on metformin, it can cause you to have low energy, memory problems. So definitely talk with your doctor if you have symptoms like that and you're on metformin about checking your B12 level or your MMA level. So that's a biggie. But basically, let me go back. Just wanted to give you that caveat about metformin. We are trying to use drugs to treat a dietary lifestyle disease. So after we are gaining this information, the question still remains, what do we do now? So I've got these helpful suggestions for you, and hopefully it'll help. So hopefully you've got a pen and paper, or type it in the comments so you can keep notes. But here we go. Number 1, swap out the processed foods, guys. All the forms of sugar, particularly fructose, as well as the grains. Let's swap it out for whole, fresh food. Swap out the processed foods for whole, fresh foods. Processed foods, what does that mean? Basically the stuff that didn't come straight from the farm, straight from the land. If you're buying it in a bag, chips, cookies, pastries, golly, the list goes on and on and on. I'm sure you know what processed foods are. If you don't, then message me and I'll try to help you out there. But those all have to go if you are really trying to reverse your condition. Because if you've got insulin resistance, you've got diabetes, high blood pressure, heart disease, if you're overweight, then you've got to bring your fructose, your sugar intake, to 15 grams per day until this insulin resistance is resolved. And again, 80% of Americans are insulin resistant. And I'll tell you, I mean, for those of you who know me personally, I'll be frank, I've been blessed. I've never really had to battle with my weight, for the most part. Aside from, after pregnancy, I had to work quite a bit to get that off. But other than that, I never had to battle with my weight. However, even I was diagnosed with pre-diabetes during residency. And a large part of it was stress, lack of sleep, and also, I'll admit, I was not eating all that good. I enjoyed my graham crackers late at night during call, and my potato chips, and the peanut butter and jelly sandwiches I got free from the ER. Like, that's what I lived off of. And even so diabetes, it does not discriminate. Pre-diabetes, it does not discriminate. You could even be not obese and develop diabetes or pre-diabetes. It's 80% of Americans that are insulin resistant. So many of us are at risk. So swap out the processed foods, all forms of sugar, even the grains, for whole, fresh food if you are really trying to reverse your insulin resistance, your pre-diabetes, your diabetes, okay? Again, limit it to 15 grams per day, and you can usually see that on the nutrition facts, how much sugar you're getting. And everybody else, if you're, trying to just prevent this condition, if you're trying to just, kill things over time, then you really need to limit your fructose to 25 grams or less. So 15 grams or less if you're fighting insulin resistance, pre-diabetes, diabetes. Or at the very most 25 grams per day of fructose for everybody, okay? The easiest way to accomplish this, guys, is to swap out the processed foods for whole and ideally organic foods. This means you're basically cooking from scratch with fresh ingredients. So processed foods, they're the main source of basically all the culprits, guys, including high fructose corn syrup, sugars, processed grains, trans fats, artificial sweeteners, all these additives. They are all aggravating the metabolic dysfunction. They're all aggravating and causing insulin resistance. So eat a low glycemic load, high fiber, plant-based diets. So that means most of your plate is going to consist of vegetables, fruits, very little carbs, no sugar, okay? It's going to have beans, nuts, okay? Some animal protein, that's okay. Try to keep it lean. Chicken, turkey, fish. And when I say low glycemic index, basically what that is when you eat carbs, it breaks down into sugar. Every carb you take in, it breaks down into sugar. Really, it just depends on how slowly the sugar is digested, how it's broken down. So when we say low glycemic index, that's the kind of carbs you're going to eat if you're going to eat any carbs, right? And what that means is when you eat it, it doesn't turn into sugar right away. Okay, so like if you're eating French fries, donuts, bread, white bread, waffles, that kind of stuff has what we call a high glycemic index. It turns into sugar immediately. So that's the kind of stuff you don't want to eat in this situation. Low glycemic index, things like vegetables, broccoli, lettuce, chickpeas, eggplant, tomatoes, things like that. Hummus, mushrooms. Those have a low glycemic index. Glycemic index. So you guys can Google that. There's plenty of resources out there of what high glycemic index is and low glycemic index. And you're trying to eat the things. Hi, Monique. Thanks for watching. You're trying to eat the things that have a low glycemic index to help you reverse these conditions. Okay, so hopefully that'll work. It'll cause you a slower rise in your sugar levels because, again, every carb, it turns into sugar eventually. It just depends on how quick, how fast, how much damage is it going to do. So aside from swapping out the processed foods and replacing it for whole, fresh foods, trying to eat from scratch, not buy your foods from a bag or a microwave dish, etc. Let's also eat a low to a moderate amount of high quality protein. High quality protein, okay? So those are things you can get your protein from: meat, fish, eggs, nuts. When you're eating the animal-based protein, though, you've got to opt for organically raised, grass-fed, pastured meat. Your eggs, dairy, I have my thoughts about dairy, but we'll leave that for another day. That's to help you avoid potential complications that come from genetically engineered animal feeds and the pesticides, okay? And most people, you rarely need more than 40 to 70 grams of protein a day. Again, 40 to 70 grams of protein a day. That's what you're aiming for. Again, you can easily see that in Nutrition Facts. There's a great app actually out there called MyFitnessPal that I've recommended to patients. You can literally put in every meal that you're eating, what exactly you're eating in your meals, and it'll actually show you, which is really cool, how much sugar you have in that meal, how much protein you have in that meal, how many calories is in that meal. So I think that's pretty neat. Eat as much high quality, healthy fat as you want. How about that? So guess what? A lot of us think it's about the calories. Oh, I gotta lower my calories. I only can eat 1,500 calories and then I'll reverse my condition. And when it comes to these metabolic diseases, guess what? That's not really it. It's about what you eat. It's about quality versus quantity. Quality versus quantity. So when you are eating, it's about what we talked about, swapping out these processed foods, replacing it for whole, fresh food, eating a low amount to a moderate amount of high quality protein, and guess what? You can eat as much high quality fat as you want. And what that means is most people need upwards of 50 to 85% of your calories can come in the form of healthy fats. That doesn't mean that you should be eating like 3,000 calories a day, guys. That's not what I'm saying. Don't overeat, because I'm sure, unfortunately, the SAD diet, the standard American diet, it's chock full of sugar. You're going to have sugar, unfortunately, in things that you just never thought should even have sugar, but they just pump sugar in everything. It's nuts. So I'm not saying eat like a crazy amount of calories, but that's not your focus. It's really about the quality of your food and not the quantity. So when I say high quality, healthy fat, what are some sources? Coconut oil, avocados, nuts, high quality animal fat, high quality plant fat. All of those things are okay to eat. And the name of the app again, Latoya, is MyFitnessPal. MyFitnessPal. Another suggestion, eat as many non-starchy vegetables as you want. Vegetables, eat your broccoli, eat your peas, eat your eggplant, eat your Brussels sprouts, eat your tomatoes, all of these fun things. Those are not going to lead, in the majority of cases, to an onslaught of sugar into your cells. Eat your veggies. Eat your veggies. We've heard that tons forever. We've lost sight of that in light of McDonald's on every corner, Burger King, Hardee's on every corner. But eat as many veggies as you want. Throw them in your smoothies, guys. Have a smoothie every day, okay? That fructose from the fruit is not what's going to hurt you like all of these processed foods. And you put more veggies in there. There are a very low amount of fructose in veggies. Exercise regularly and intensely. So studies have shown that exercise, even without weight loss, it increases your sensitivity to insulin. So I'm talking about more so vigorous exercise, guys. Hi, Ruth. Thanks for watching. That means fast walking, running, biking. If you can sing while you're exercising, then it's not vigorous enough, okay? And the recommendation is at least 30 minutes, 4 to 5 times a week of the vigorous exercise, and then strength training for 20 minutes 3 times a week, okay? So at least 30 minutes, 4 to 5 times a week of vigorous exercise, and also strength training, you know, lifting weights, things of that sort, for 20 minutes 3 times a week. All right. Another suggestion, improve your omega-3 to omega-6 fatty acid ratio. So what does that mean? You hear about, you know, omega-3s, omega-6, there's even omega-9s, which we don't really talk about much. But believe it or not, we're actually supposed to have a 1-to-1 ratio, basically, of omega-3s and omega-6. And most people would assume that we do when we're eating, like, you know, lots of nuts or seeds or the healthy oils or a lot of fish. But believe it or not, the average American, our ratio is 50-to-1. 50 omega-6s to 1 omega-3. And when we're out of balance like that, actually omega-6s are pro-inflammatory. It increases the inflammation in your cells, which is a big cause of insulin resistance. Whereas omega-3s are anti-inflammatory. It helps to increase your sensitivity to insulin. It helps to get rid of the insulin resistance. So the main sources of these omega-6s that you probably should cut down are corn. Corn is, again, for another topic, but try to cut down majorly on that. Soy, canola, safflower, peanut, sunflower oil, okay? Especially corn and soy, because believe it or not, they're typically genetically engineered. And again, for the reasons we talked about, it's foreign to your body, it's going to cause a defense mechanism, inflammation's going to go haywire, thereby we get this insulin resistance to develop even worse, right? To help bring up your omega-3 intake, then basically you need to reduce your consumption of a lot of those vegetable oils I just talked about and increase your intake of things that are high in omega-3, like krill oil or flaxseed oil, walnut oil. Those are actually very high in omega-3. And for those of you who are thinking about like those fish oil capsules, be very careful about that. A lot of times they put in a lot of omega-6s into those capsules, so pay attention to exactly what kind of omegas are in those fish oils. A biggie also to help reverse your diabetes is maintain high levels of vitamin D, and that should be around 50 to 70. And you can get that through getting good sunlight, even a safe tanning bed. I prefer sunlight, or even just supplementation through a pill. We talked about that at the last talk, but make sure if you're diagnosed with prediabetes or diabetes or even insulin resistance, get your vitamin D level checked. About 90% of Americans are vitamin D deficient. So, I mean, most of us are just definitely not getting enough sun anyway. It should be tested irregardless. Vitamin D, gosh, it's amazing. It helps with bone health, decreases risk of heart disease, cancer, diabetes, helps with your energy. There's so many great benefits of vitamin D, so make sure you've got good levels of that. And also sleep, that's super important. Remember, I just talked about, even me, when I was skinny Felicia, I had pre-diabetes, and I believe a big part of it was I wasn't getting sleep. I was eating too many processed foods. I was stressed out. This was during residency. So sleep, that's a biggie. Get a good amount of high quality sleep every single night. Because if you're not getting enough sleep, it raises your stress levels, which raises your blood sugar, because that's what cortisol, the stress hormone, does. And there's actually a study out there that said that women who got less than 5 hours of sleep, or believe this, more than 9 hours of sleep each night, they were 34% more likely to develop diabetes. So if you need some tips on helping you with sleep, check out my video called Doc, Why Am I So Tired? Hopefully that'll be helpful to you. Latoya, to answer your question, what about black seed oil and chia seeds? Chia seeds are fairly high in omega-3s. Black seed oil, I might have to get back to you on that. If I'm not mistaken, they should also be pretty high on omega-3s as well. So those are fine, but I would double check that. There's a really good resource for that, which I can put in the chat for you afterwards and tag you to it. Another biggie is maintain a good body weight. We already are pretty sure of that. And guess what? If you make the changes that we already talked about, replacing the processed foods for whole, pure foods, exercise regularly, change that omega-6 to omega-3 ratio, eat high quality fat. Hi, Catherine. Thanks for watching. Eat a low to moderate amount of high quality protein. Guess what? Losing weight, it's going to be a side effect of all these things anyway. You don't even have to focus on it. Those pounds will usually just shed off, okay? So maintain a good weight. And I know people focus on BMI, but just keep this in mind. It's a really poor indicator of where you are health-wise. It's not that helpful anymore, and there's tons of studies to show that. So don't even bother necessarily about focusing on your BMI. There's actually your hip, down here to your waist ratio. That is actually a much higher marker of your risk of high sugars, what we call metabolic syndrome. So you can probably Google that to find out what your hip to waist ratio is, and that's more so what you're going to focus on as you shed the pounds. And if you've tried all of those things that we just discussed and you're still not getting where you want to be with regards to your sugar, then consider intermittent fasting, okay? And it has by far been an effective way to shed your fat, to eliminate your sugar cravings, and there's a lot of great literature, great studies out there on it. I could do a whole live on exactly what intermittent fasting is, so we're not gonna go into that in crazy detail and keep everybody up so they don't get sleep and then their sugar levels go high. But basically, when you are fasting, you develop a higher level of ketones, which is a byproduct of burning off fat. And ketones are actually the preferred fuel for your brain, not sugar. So when you fast, then it makes a major difference, whether that's you just eat between 12 p.m. to 8 p.m. During the day and you fast the rest of the day every day, or you just go one day every week fasting. It helps to develop your insulin sensitivity. So if you'd like to discuss that more, then message me and we'll chat about how we do that. And the last thing I think of major importance is to help improve your gut health. So your gut, it's a living ecosystem. It's full of bacteria, good and bad bacteria. And a lot of studies have shown that obese people, they have different intestinal bacteria than people who are lean. So the more good bacteria you have, the stronger your immune system is, the more your body can function in an optimal way, guys. So it's relatively easy to bring your gut flora in tune. You're gonna basically feed it with good bacteria like unsweetened yogurt or fermented foods. You might have heard of kimchi, sauerkraut, pickles, kombucha, things like that. And if you need more recommendations on how to improve your gut health, we can chat about that as well. So let me just recap again. We talked about a lot of ways, guys, to help to improve your condition when it comes to insulin resistance, prediabetes, diabetes. And I'll recap it for you again. We talked about changing the situation, swapping out processed foods, replacing it for whole, fresh, organic foods. Also, eating a low to moderate amount of high quality protein, okay? 40 to 70 grams of protein per day. And as for the sugar, we're getting rid of as much sugar as possible. 15 grams, no more than 15 grams of fructose per day if you're trying to reverse your condition. And for the average American, even if you're not dealing with this, 25 grams or less per day of fructose. Eat as much high quality fat as you want, especially from plant fat, so avocados, nuts, things like that. Keep your vitamin D levels optimal, between 50 to 70, okay? Get high quality sleep every night. Again, the studies show for women especially, less than 5 hours of sleep, it increases your risk of diabetes by 34%. 34%. So we're aiming for 8 hours of sleep, 7 to 8 hours of sleep a night. Keep a healthy body weight, and that is a side effect of all the things we just discussed, okay? Exercise regularly. 30 minutes, 4 to 5 times a week of good, intense exercise, and 20 minutes, 3 times a week, okay, of balance training, strength training. Improve your omega-3s to omega-6 ratio, all right, and we talked about that. And if all else fails, then consider intermittent fasting, okay? And gut health, we talked about that too. So all of these recommendations, they are going to need the helpful coordination with your doctor though, guys, okay? Especially if you're on any medications to treat your condition, prediabetes or diabetes. A side effect of this, of course, is going to be your sugar is going to get lower. And that is great, but it's not great if you pass out because your sugar is too low, because you're making these great changes, but your medication dose is too high. So you need to coordinate this with your doctor, okay? So talk with your doctor. If you want to make an appointment with me, I'd love to talk with you further. Let's work on getting well. If you're ready to make these changes, especially intermittent fasting, keep in mind your human body, it's sensitive, okay? So even if you're making a change for the better, you may experience the side effect of your sugar going low. And that's important for you to coordinate that with your doctor. Keep your medical provider in the loop so they can monitor your changes, congratulate you with your progress along the way. Okay, was this helpful for you guys? Give me a thumbs up. Let me know, comment below. Let me know if this was helpful information. I hope it wasn't too long. I tried not to belabor things, but I wanted to get, I hope, very helpful information to you and your loved ones so you and your communities can get well, whole, energized, and living life, okay? Whole, energized, and loving life, okay? Let me answer any questions you have. If you have a question, type it in below. But thank you so much for joining me. Catherine said, my doctors gave me a blood test for diabetes, so I missed that. So I'm working on it now because I don't have time for that. I'm telling you, ain't nobody got time for this, right? So again, the decision is hard. The decision is hard either way. It's either a decision to inject yourself a whole bunch of times a day with insulin, or take medications all the time, go see your doctor all the time, get stuck all the time to check your sugars. That's hard. But I know it's also hard to make these major changes. But which life would you like to live? Which life are you going to love? What are your goals? Think about, what are your goals? How do you picture your life next year, in 5 years, in 10 years, in 30 years? Are you picturing enjoying time with your spouse, with your kids, with your grandkids, with your pets? Are you picturing going on vacation? Are you picturing sticking yourself a whole bunch of times a day? Envision the life that you want, and how do we take those steps to reach those goals to become well, whole, energized, and loving life, okay? So thanks so much for tuning in. I do hope this information was helpful. If it was, please comment, tag your friends, share this information, okay? And talk with your doctor to coordinate finding that progress again, okay? Coordinate. Diabetes can be reversed, guys. Pre-diabetes can be reversed. Insulin resistance can be reversed. I know, I've had to do it myself. So find someone who can help you get there, okay? And be well, whole, energized, and loving life. Best of wishes to you in your continued journey to a healthier and a more well you. Thank you so much, and have a great night, everyone. Take care.